From the changing of welfare reform work requirements to implementing the new health care law, there is concern this week in some key states where the 2012 presidential election could be determined. Joining us now are governors from two of those states, Rick Scott of Florida, who comes to us from San Francisco, and Terry Branstad of Iowa, who's attending the National Governors Association meeting in Virginia. Welcome to you both, gentlemen. Let me start with this question that stirred so much interest at the end of the week, which is a set of new possible waivers by the federal government of work requirements under welfare reform. This would appear on the surface, at least, to be simply a case of the states getting some more flexibility in how they administer the work requirements for receiving welfare benefits. Let me start with you, Governor Branstad. How do you see these waivers? Some people are saying that it's going to gut the law.
Well, unfortunately, I think this is a huge step in the wrong direction. I was governor along with Tommy Thompson from Wisconsin, John Engler from Michigan, when we worked with the administration back when Bill Clinton was president to get the welfare reform passed, to move it from an entitlement program to a program that focused on job training and work, and we helped move millions of people off the welfare rolls into permanent employment. We reduced the costs of welfare and Medicaid as a result of it. It was very successful, and now we see this administration trying to gut it. I think it's illegal because it's in the law. I don't think they have a right to waive it. I know Tommy Thompson is saying he's thinking about suing them over it. I think it's absolutely wrong and a move in the wrong direction. The focus needs to be on helping people to move from welfare to work, not making people permanently dependent on the government welfare program. We know that didn't work back in the 70s, 80s, and finally we changed it in the 90s. This program has worked. It's absolutely a terrible step in the wrong direction.
But, Governor, isn't it a little unusual for a Republican like yourself to be arguing that the federal bureaucrats in Washington, with the rules they've laid out for this, know better than the governors in the states across the country and subordinates about how to best implement the law?
Well, actually, the governors are the ones that wrote the law in the first place. We're the ones I mentioned, Tommy Thompson, John Engler. You can talk to those governors that helped pass this law, and we saw it work effectively in our states. The welfare rolls went down substantially. We helped a lot of people move to a higher standard of living and more opportunity, and this guts it. This goes back to the kind of entitlement mentality, and that's the big mistake.
But Governor, they haven't eliminated the work requirement or the requirement that there be activity underway that leads toward work. They're simply allowing the states to have more flexibility in how to implement that, aren't they?
Well, what I'd like to see is more flexibility on the Medicaid program. I chair the Health and Human Services Committee for the National Governors. We'd like more flexibility instead of these maintenance of effort requirements that the federal government has imposed on us in Medicaid.
Governor,
so if they want to give us more flexibility, do it under Medicaid and don't gut the welfare reform.
I'm going to come to Medicaid in just a moment. Let me turn to Governor Scott. Governor, how do you see this adjustment in the government's rules, federal government's rules on the work requirements for welfare?
Well, Governor Branstad's right. I mean, first off, it'd be great if they'd give us more flexibility on Medicaid, because that's just killing our state budgets. But with this, I mean, personal responsibility is very important. In our state, unemployment, the number of people on unemployment in the last 18 months has gone from 568,000 to 321,000. And part of it is personal responsibility. People need to be going out looking for a job. If we don't want people to stay on welfare, we want them to get back to work, and that's what governors want. We want our states all busy with more jobs.
But, Governor, aren't you now in a position, with the flexibility granted to you by the federal government, to set the welfare to work requirements pretty much however you want it done?
We'll look at this, but I mean, we're going to keep the responsibility in our states. I mean, I just wish they'd do this for everything. Do this for Medicaid. Medicaid in our state's growing 3.5 times our general revenues. Give us more flexibility on Medicaid. Give us a block grant. That's what they ought to be doing. But with this, we believe in personal responsibility, and we're going to continue to have personal responsibility in our state. We want people to go look for a job and get back to work.
I assume, Governor, you'll do the same thing in Iowa, keep requirements similar to what you've got, correct?
Absolutely, and I've got Chuck Palmer running the Department of Human Services for us again, and he helped me. He ran it back in the 90s when we were able to dramatically reduce the welfare rolls and keep Medicaid under control. Medicaid is growing dramatically in every state.
Well, it's
an entitlement program that we can't continue to afford.
Well, let's talk a little bit about Medicaid. The Supreme Court has ruled that the federal government cannot require you to take on additional Medicaid patients in order to get the new money that would be available for that. You now have the flexibility to say no to that. What are you going to do, Governor?
Well, first of all, think of this. The federal government has a $16 trillion national debt. 40 cents of every dollar they're spending is borrowed money. And what do they want to do? Add another 15 to 17 million people to the Medicaid rolls. It's unaffordable, unsustainable at either the federal or state level. And if we buy into it, then we have this maintenance effort requirement. And when the federal government can't afford to do it, the burden gets dumped on the taxpayers of our states.
So what are you going to do?
What we're doing is, well, I've already embarked on a goal to make Iowa the healthiest state in the nation. We're working in a public-private partnership with the private sector businesses like Wellmark, our largest health insurance provider, and with Hy-Vee, our large supermarket chain, identifying ways that we can help people to do health risk assessments, identify how they can reduce their risk factors. And so our goal is to partner with the communities, partner with the private sector to help reduce the health care costs, not buy into a government program that's unaffordable and unsustainable.
So you're not going to accept you're not going to expand your Medicaid program the way the health care reform law contemplates, and therefore you're not going to get the extra federal money that, at least for a while, goes with it, correct?
Well, our concern is the federal government certainly can't afford it, and we don't think the state of Iowa can do it. And I think if you look at it realistically and you look at what they ought to be doing and quit digging into a deeper hole, we've got to reform these whole entitlement programs. The Health and Human Services Committee yesterday, we talked about things that can be done to manage the Medicaid better instead of expanding it. So that's what I want to do. I don't want to embark on something that's unaffordable.
All right, Governor Scott, what are you going to do in Florida about this?
We've got the same concern. The federal government can't afford this. We can't afford it. It doesn't make any sense to do this expansion. What they ought to be doing is creating more choice, creating more competition, give individuals the same tax breaks as employers so you own your own policy, reward people for taking care of yourself. Those are things, and help people get back to work so they can afford their own health care. This is just another government program where the federal government will run out of money and they'll put it on the states again. We can't afford it in Florida. Medicaid in our state is growing at 3.5 times our general revenue. And it's a big program. It's over a $20 billion program. We can't afford it. And now what we're doing in our state with Medicaid is we're going to a statewide managed care program. But even with that, we're waiting on the federal government for a waiver. So, give us the flexibility to fix our Medicaid program, but don't force us into a program that the federal government we know can't even afford.
Well, Governor, you ought to be knowledgeable about this as a former hospital executive. Hospitals are saying now, which are required in most states by law to accept whatever patients arrive, whether they have insurance or not, that if you don't have Medicaid expansion, and the uninsured people are going to continue to turn up in large numbers at hospital emergency rooms expecting and by law required to get treatment, that money is going to come out of the people who do have insurance or out of the hide of the hospitals. So if you don't expand Medicaid, what are you going to do about that problem?
Well, the way to fix that is what we've already proposed. We're waiting for a waiver from the federal government, is a Medicaid expansion across the state where the Medicaid population will be taken care of by managed care organizations, which will help make sure they get to a primary care doctor or get to a specialist so they don't end up in an emergency room. That's the way to fix it. Don't take money from the federal government that we know long-term they're not going to be able to give to us.
All right, let me turn to one other question here. Let's start with you again, Governor Scott. I was looking at the latest Florida poll on the presidential race. Shows, and looks like a pretty good poll, 800 likely voters, and it shows a very slight, well within the margin of error lead for President Obama. One wonders about this. This is a state that the president carried by only a small margin against John McCain 4 years ago. It's a state with an unemployment rate 8.6%. That's 0.4 of a percentage point above the national average. It's a state where you have a lot of elderly people who presumably, that's one age group that tends to favor the Republican in this race. Why is it that President Obama is doing so well in Florida?
Well, as you said, our unemployment rates come down dramatically. We've had the biggest drop in the last 18 months of any state but one. But this race is just like my race in 2010. It's going to be 100% based on who's got the right jobs plan. I think President Obama's going to get hurt unless the economy continues to get better. I think Governor Romney, if he has the right jobs plan, he gets his message out, he'll be the winner here. It's going to be about jobs. Who's got the right plan for jobs?
Governor Branstad, the state of Iowa suffered less than many states in the economic meltdown. The unemployment rate, I guess, got as high as 6.3%. It's now down to 5.1%. That's well below the national average. President Obama, in current polling averages out in Iowa, we can perhaps take a look at one of those polls. Yes, here we go. Is enjoying, a 2.5 percentage point lead. That's a real clear politics average of a number of polls. It strikes me that this state looks like a tough state for Governor Romney. Wouldn't you agree?
Well, Obama carried it by 10 points last time, but he campaigned as somebody who was going to unite people, and he's been the most divisive president. So there's a lot of independents that voted for him last time that really feel betrayed. They feel that he spends all his time attacking other people. Contrast that with Ronald Reagan. When Ronald Reagan ran for re-election in 1984, his theme was Good Morning in America. He talked about all the things he's doing to revitalize the American economy and revitalize the American dream, reducing taxes and regulations. That's what I'm doing as governor. That's what Republican governors are doing all over the country. Contrast that with Obama and his Illinois friends. He's from Chicago, and the Democrats control Illinois. What have they done? They've got the highest debt of any state in the country.
I know,
per capita.
But you
they
don't.
Have the most
But your state's doing better. Doesn't that help the president?
It helps Republicans because they can see with a Republican governor, we've turned it around. So has Wisconsin, so has Michigan, so has Indiana. Illinois hasn't. And Illinois is following the Obama rule of raising taxes on corporations and individuals and driving and attacking the very people that you need to invest and create jobs. In Iowa, we're doing the opposite. We're reducing taxes and regulations.
Let me ask you both very quickly one question, and that is the Obama campaign has mounted some pretty intense attacks on Governor Romney on his record at Bain Capital and on questions of whether he was still there when outsourcing was allegedly being done and so forth. Does it appear to you now, based on the polling we're seeing with the president ahead, even in states like Florida and certainly in your state, that those attacks are having some effect, Governor Scott?
I think it's going to come down. What Governor Romney needs to do is just keep talking about the plan he's got to get our economy back to work. When you go to the polls and you decide in November, it's going to be who's going to help me get my job back, who's going to help me keep my job. They're not going to worry about some attack on Bain. They're going to worry about who's got the right jobs plan.
All right, Governor Branstad, your thoughts on that?
Well, it's pretty pathetic when the President of the United States, instead of running on his record, as Ronald Reagan did, with Good Morning in America, is spending his time attacking other people, attacking Romney, attacking the entrepreneurs and the businesses that we need to have the guts to invest and create jobs and grow our economy. That's what Republican governors are doing. That's why our states are doing better than states like California and Illinois, where the Democrats are continuing to raise taxes and regulations. That's the wrong direction. We need a new leader. We need a new direction. I feel at the end of the day, when the American people look at the choice, obviously Romney, with his experience and background in the private sector and having rescued the Olympics, is a better choice than the present incumbent who's... It's the blame game, and that's the wrong thing to do for the President of the United States.
All right, Governor Branstad, Governor Scott, thanks to both of you for your time.